With regards to continence, we know that men over the age of 70 have the highest risk of incontinence in individuals. Does that mean that a 55 or 65-year-old man doesn't have a risk for developing incontinence after prostate cancer surgery? The answer to that question is no. But we do know that men 70 and above are at the highest risk. I think primarily this is because the pelvic floor muscles are not as developed in those individuals that are older when we compare them to those individuals that are younger. All my patients that have a robotic prostatectomy meet with a physical therapist and learn how to do Kegel exercises. These are pelvic floor strengthening exercises that I found have been very beneficial with earlier return of continence in my patients. With regards to erections, the nerves that supply the penis for erection run alongside the sides of the prostate. When we remove the prostate, we don't use any cautery near these nerves because we don't want to burn them and injure them. We don't cut the nerves, but we do know that these men potentially have a risk of the development of erectile dysfunction. What causes that erectile dysfunction? Well, that's been studied, understanding where the nerve endings are in individuals. Numerous very analytical and anatomical studies have been done investigating this. And indeed, we know that peeling these nerves off may cause a little bit of a stretch injury to these nerves, which temporarily causes impotence to develop. Over time, though, if we're able to preserve those neurovascular bundles, the return of potency occurs. What's important is understanding what your erections are before you have prostate cancer surgery. We know that age is extremely important. Men that are 55 and younger do better. And all my patients fill out a sexual history inventory. In other words, trying to understand what their erections are preoperatively. I always use the analogy with my patients that if you have a lemon, we can make lemonade. We can't make fruit punch. In other words, if your erections are poor prior to having surgical procedures done on the prostate, whether it's an open prostatectomy or a robotic prostatectomy, if the erections are poor, I can't make those erections better by doing prostate cancer surgery. Taking out the prostate will not improve my erections, and more likely than not, will cause damage or impotence to occur in these individuals.
On this field, a single decision can change a game. For a man with prostate cancer, a single decision can change his entire life. While I chose surgery, a less aggressive approach called active surveillance might be the best choice for you. Ask your doctor about a genomic test that may help you make the right decision. Learn more at yourprostateyourdecision.com.